Hey everybody, welcome to Permanente Docs Chat. I'm your host, Alex McDonald. I practice family and sports medicine here in Fontana, California, and am a partner of the Southern California Permanente Medical Group. So thank you all for joining or tuning in today from wherever you may be watching or listening. Make sure you follow all the podcasts as well too, so we can catch up on all these great conversations we have here on the Permanente Docs Chat. So I am very excited to welcome our guest today, Dr. Matthew Solomon, who is a cardiologist from the Permanente Medical Group and director of the Center for Thoracic Aortic Disease, as well as a very robust cardiovascular researcher. He's done multiple different areas of research involving valvular heart disease, coronary artery disease, arrhythmias, thoracic aortic disease, and February is Heart Month. And so we're going to be talking about all things heart and cardiac care today. So if you're watching this live, feel free to drop questions in the chat, try and do them early so we can get to them. And we were going to just jump right in here and keep this high yield and enjoy our conversation here. So Dr. Solomon, thank you so much for joining us. Let's just jump right in. Tell us a little more about who you are and what you do up there at Permanente Medical Group.
Yeah, absolutely. Thanks again for having me. I'm Matt Solomon, and I work in the KP Northern California region, where I'm a clinical non-invasive cardiologist and a cardiovascular outcomes researcher. I wear a number of hats up here besides those. And within my research field, I'm a member of TPMG's Physician Researcher Program, and I'm an adjunct investigator at DOR, where I work with several different teams doing cardiovascular outcomes research since in the 10, 11 years since I've been here. I started in 2012. And then, as you mentioned, I founded and direct a subspecialty program for patients with thoracic aortic aneurysms, which has turned into a real passion of mine over the past several years. And I'm really proud of that. And I think we've really improved care for patients with thoracic aortic disease quite a lot. And I think the last hat I wear is I started working recently with a team called the Augmented Clinical Intelligence Team, which helps work to implement AI and predictive modeling efforts within NorCal to improve clinical care.
Wow, that's phenomenal. So lots of different hats for sure. So I'm sure we can talk about lots of those things and touch on a lot of those things.
Yeah.
Tell us a little bit about sort of the cardiac care program at TPMG and how it's unique. And I mean, I know you mentioned the thoracic aortic aneurysm program specifically, so feel free to expand on that. But tell us more about kind of the comprehensive cardiac care program you have up there.
Yeah, we have an amazing cardiac care program that I think is really nation leading. And one of the big aspects of why I'm really proud to be part of this team is that we really practice integrated team-based care. And, we have 21 medical centers across NorCal, and we operate in really a hub and spoke model. In cardiovascular care, you have to have teams to take care of patients. It's not just one cardiologist. It's not just one cardiac surgeon. We all work together, and care is, getting more and more complex as time goes on. So, there are a lot of disease conditions, which are kind of our bread and butter, the daily things that we see, but we often see things that are kind of rare. We rely upon each other for those rare things. And patients don't always fit into the box. And so it's really important and useful when we're able to get together and put multiple minds on the same case. So, to give you an example, we have grown our structural heart program over the past decade into one of the biggest programs in the country. And that really involves a lot of different practitioners, cardiologists, surgeons, imaging cardiologists, because the cases just aren't always straightforward. And so I think our ability to kind of work together and put the patient at the center of what we do really kind of distinguishes us from everywhere else.
Yeah, I've said this multiple times before, but it bears repeating that, medicine is really a team-based sport. And when you can kind of really wrap all those services in sort of integrated fashion around the patient, it really makes for better outcomes and a more efficient care as well, quite frankly, and higher quality care as well.
Yeah, absolutely. And it's, satisfying for the physicians taking care of the patients too, because there are some things that are kind of black and white in medicine where it's very clear what the right thing to do is, but there's so many areas where it's fairly gray, and you really need to talk out loud about the data, and the specific, characteristics of the case with your partners and figure out what the best thing to do is. In fact, I remember when I interviewed at KP, one of the things that struck me were the hallway conversations that the cardiologists were having. I was interviewing for a job, and I think during that time, a couple other docs came in the door to, knock on the person I was interviewing with and say, hey, can we discuss this case? And I thought, that's the kind of place I want to be.
Yep, that's phenomenal. I definitely love that approach. Tell us more specifically about the thoracic aortic aneurysm program, which obviously sounds like you have a passion for and some research in that area as well too.
Yeah. I'm really grateful to our group and the leaders that sort of gave me the support to help build this. But it sort of started when I began here. I had some patients with aortic aneurysms, and I hadn't really trained in it specifically during my my fellowship. But I knew that there were some experts at the institution where I trained at Stanford University, not too far from where I work now. And so I kind of asked around and I said, well, who's our expert in aortic aneurysm? And the feedback I got was, well, we don't really have one. And I thought, oh, this could be kind of interesting. I was, dovetailing research with my clinical care. I knew this was an area where there wasn't a lot known. So I first approached it from kind of a research perspective. And I thought, we are such a big system. We must have so many aortic aneurysm patients. We could put together, probably the largest cohort in the world and help inform care. So I got a small grant to do this. And then as I started doing that and got interested, the referrals started coming in. Hey, Matt, can you see this, complex aortic patient? And I, kind of got deeper into the disease condition. And actually one of the mentors where I had trained said, hey, if you're interested in this, why don't you come back and I'll give you some additional training. And my group was very supportive. They let me go down to a clinic, a handful of times down at Stanford where I learned more. And I really just kind of fell in love with the broader community of aortic physicians from around the world that really come together to care for this patient team. And they sort of saw quickly that the program that we were putting together was going to be unique. Being that we're an integrated system, we have incredible experience in population management. Obviously, we do such a great job with high blood pressure and diabetes and all of these preventive measures. We also have the opportunity to do incredible population management for specialty conditions. And that's what we've built up here. So we manage about 12,000 patients now with thoracic aortic aneurysm. We have a team of nurses and medical assistants, and we work tightly with cardiovascular geneticists and our both cardiac and vascular surgeons. And again, that's providing that kind of multidisciplinary, multi-specialty care is really satisfying. We've had the chance to present the program and some of the innovative things we're doing nationally, internationally, and these other groups, want to kind of mirror some of the practices that we have.
Wow, that's phenomenal! Congratulations on all that work. I guess makes me think of Field of Dreams. If you build it, they will come, right?
Yeah, kind of true.
I think one thing that I always like to point out. I mean, again, I practice family medicine and sports medicine, and some of my patients, a lot of my high end athletic patients, particularly if basketball players. I have a couple professional basketball players I take care of, and we've gotten echoes, and they have an enlarged thoracic aorta, and it's like, is that normal for somebody who's 7 feet tall, or is that an aneurysm? And there's a lot of gray sometimes in these areas too, and having people like yourself and experts that can really kind of collaborate to really provide the best care is so unique. I find a lot of patients know about KP for our high quality, especially when it comes to preventative medicine. But I think a lot of people don't necessarily realize just the high quality of specialty care that we can provide as well too. And I think this is such a great example. So kudos to you and your team for building this.
I agree. I mean, for the structural heart program that I mentioned, we do more transcatheter aortic valve replacements. It's nicknamed TAVR, but we do more than any place west of the Mississippi. So we're really one of the biggest centers out there. And, that team got involved in a lot of the pivotal trials, and the team leaders are authors on, those high impact publications. And so I think, our organization just continues to distinguish itself. But I agree with you. Prevention is what we built our name on, and we do incredibly well. And that's not going to change. We're going to be a leader in that, and we should be. And that's really, I think, what's responsible for so many of the encouraging trends we've seen in cardiovascular disease over the past couple of decades. It's not the care that, we're providing as cardiologists necessarily is the reason why heart attacks have gone down so much and strokes have gone down. It's what you do in AFM and making sure that patients are getting their preventive care. And when they walk in, they're getting blood pressure checked all the time and getting on appropriate medications like statins when it's indicated. So that we have, really set the bar for. But I think, like you said, in a lot of the specialty areas, it's also becoming clear that we can set the bar there too.
Yep, absolutely. And that's actually a great segue into my next question. I was going to switch gears a little bit here, talking more about prevention. And so last I looked this up, and these stats may be a little bit old, about 25% of all deaths in this country can be attributed to cardiovascular disease. And it's the number one cause of death in the US. How do we reverse this trend? I mean, I think we've made progress, but how do we make sure we continue to reverse this trend and reduce the disease and then the deaths due to cardiovascular illness?
Yeah, I agree. We've made incredible strides with all of the preventive work that we've done. We have seen the rates of cardiovascular death and disease go down quite a lot, but it's still really prevalent. And in fact, every year they come out with statistics and they look at the leading causes of death, and whether it's cardiovascular or cancer, they're always sort of neck and neck. It's not something you want to be number one in. Right?
Exactly.
But I think continuing with, the direction that we're headed, making sure that people live a healthy lifestyle, that they exercise, that we are reducing tobacco use and smoking. These are incredible strides that we've been taking. The idea is not to just rely upon medicines, because once you, get on medicines are amazing. Don't get me wrong. Blood pressure medicines, statins, I'm a huge believer. But there are so many things that you can do with your lifestyle to help ward off disease. And I think that, it seems that as much as we can sort of, continue to push that trend, then we'll be doing ourselves and our patients, quite a service.
Yep, absolutely. Completely agree with you. I mean, and obviously as a family physician and a sports medicine physician, I'm constantly preaching about lifestyle, diet, sleep, exercise, stress relief. It's going to do more for you than any medication we could ever prescribe. You did mention statins. And so, I think the needle has moved a little bit on statins. I think maybe 5 or 10 years ago, we were undergoing what I like to call the statinization of America. Like literally you sneeze and you can qualify for a statin, it felt like. But now it feels like we're like readjusting a little bit to find that middle ground. What are your thoughts in terms of statin medications, for prevention, and then 2, what do you say to patients when maybe they're a little bit, hesitant to take a statin, even though their cardiovascular risk is maybe 10, 15, 20% in some cases? Yeah,
those are great questions, because it comes up all the time. I think that we owe a lot to that class of medications as far as what it's done for reducing cardiovascular illness burden and death. There's no doubt about it. I think as we continue into the future and using a lot of innovative research techniques and analyzing big data to figure out, who are the most appropriate patients to benefit from a statin, what is the right, agent and dose to use. I think we'll continue to hone in and really refine that risk assessment and risk reduction. That said, there's also a ton of data, like indisputable data, that has demonstrated the safety of statins. The safety profile of statins is phenomenal. And I think, 10 years ago, 20 years ago, there were things that we were worried about that really haven't come to play, with the fact that, tens and hundreds of millions of people have been on these medicines now for decades, particularly with the impact on the liver and the impact of, does it affect, diabetes risk and, this extremely rare risk of rhabdomyolysis that, I've never even heard of a case. And so I think a lot actually has leaned, at least in the medical literature, has made us feel that statins are really a safe medicine. And we don't, the guidelines don't even recommend checking some of the things regularly that we used to do many years ago. So I think that, so I think that's very promising. So I try and share those that information with patients. And, there are things that patients can do to, if they are having, say, muscle cramps from statins, like coenzyme Q is a good agent. You can also try other statins, there's many in the class now, or slightly reduce the dose, even though there's a good dose response relationship. For patients where statins indicated, just being on any statin is beneficial.
Yeah, and I always tell people, for something like a statin, obviously we want to get you on sort of a therapeutic dose, but even a little bit of statin can help, thin out the atherosclerotic plaques and reduce the risk of high blood pressure and cardiovascular events and thrombosis and you name it, right? And some patients, I find this takes some time and some convincing, and you have to have multiple conversations with them. And most of my patients are very passionate about lifestyle, and they say, "Doc, give me a chance. Let me work on my diet. Let me work on my exercise." And I'm like, "Well, your LDL is 210, and chance of you getting that down just with exercise is pretty low, right? Let's do both, right?" And so I think sometimes it's a conversation, and really it takes a while sometimes, and that's part of the reason I love being a primary care doctor, is you build that longitudinal relationship with patients over time. And you can say, "Remember that conversation we had about a statin last year? Well, it's looking like we should probably start it again now, or reconsider."
That's right. Too. There are a lot of myths out there, about statins for sure. And so a lot of our job is working to dispel those myths, but, and also just meet the patients where they are and help understand what's most important to them. Because at the end of the day, our job isn't to be paternalistic or prescriptive to our patients, is to educate our patients so that they can make the best decisions for themselves. Yeah. Right.
That's so well said.
I love that case you presented with the LDL of 210, because you probably have a program like this in Southern California. I don't know, but we have, one of my colleagues started a familial hypercholesterolemia program where, they can go out and just find patients who have, say, an LDL over 200, which is really a high risk marker for FH.
Exactly.
And it's so important to identify, because that's a genetic condition, and children who have that actually need to get put on statins in childhood, and it can be, it can reduce their risk of having an MI, which often is guaranteed in that condition, by a massive number.
Yeah.
So that's, those are some areas where I think big data and AI really can have such a big impact on what we do, because as I find in my thoracic aneurysm work, rare diseases are rare. Not everyone knows about them. And so you need some support. But when you identify a case where there's something hereditary, identifying all the family members is so important. I mean, it's you can really save a life that way. I've had patients where they have an aneurysm that's just mild or moderate, but we hear, in our detective work, we find out there's some family syndrome that may be going on. When we test the children, the kids, the kid who maybe is an adult kid, let's say like 20s or so, may have a massive aneurysm that needs to have surgery straight away and would have gone undetected, and could have been fatal. So I love that about our system, that we can do that.
Yep, absolutely. Well, let's chat a little bit about sort of the other kind of preventive thing we can do here is controlling blood pressure. So obviously hypertension is a significant risk factor for heart disease and coronary disease, and kidney problems, and you name it. There are a lot of other issues too. So what are your favorite tips for improving blood pressure? What do you tell physicians who are trying to counsel their patients? What do you tell patients regarding, best ways to improve blood pressure?
Yeah. Well, the first step is really just like knowing your number, right? Like checking it in the first place, and not avoiding that. If that means doing it as a patient in the Walgreens, where they have a cuff, that's great. Or getting a cuff, from for yourself, which are only about $20 or $30. So knowing your number is really important. And KP is obviously great about that. You can't barely walk through the door without getting your blood pressure checked. But there are a lot of lifestyle things that can be done in addition to medications. A healthy diet, weight loss, if you're overweight, is really important. Reducing stress, you alluded to that earlier. And I think that we as a society are really better understanding the impact of stress and anxiety on our health, and really, moving toward helping mitigate that, whether that's with meditation apps, that actually KP makes, I think, free for members. But those are really important things. Reducing salt in your diet's another important one. And exercise, I think is really key. Good sleep is actually being, found to be, there's more attention being paid to good sleep patterns and making sure you get enough restful sleep. And understanding its impact on health. So there are a lot of things you can do, in addition to if you need medications to help reduce blood pressure.
Great. Awesome. Yeah. Great tips. Yeah. Well, this is wonderful. We could probably go on all day, but we try to keep these pretty high yield. So last question here, and you've talked a lot about this too, but what makes you most proud to be a Permanente physician?
Yeah. I think, one thing when people ask me what working at KP is like, and I say this and it sounds kind of corny, but I really think it's true, is that it's a place where I really believe in the mission. And the mission of KP really puts the patient at the center of everything we do. And, the reason I came here is because it's an integrated system. The incentives are aligned to really do what's right for the patient and not have to think about anything else. No one is looking over our shoulder telling us, hey, do this, do that. That's a big misconception about KP. It's really just do what's right for the patient. And that is always, the most important thing, no matter what it is. And so it feels really good. And I'm really proud to work in a place where that's the mission.
Wonderful. Well, thank you, Dr. Solomon, so much for joining us today and sharing your expertise. We really appreciate it.
Thank you. It was wonderful to be here. Have a great day.
And thanks to all of you out there for watching or listening to this podcast.